Gentlemen over 50, let me ask you something. When was the last time you woke up with real morning strength? Not from a pill, not from forcing it, just your body doing what it used to do on its own. If you have to think hard, if it has been weeks or even months, listen carefully. This is not just old age. It is a signal. Your body is not broken. Your erections have not disappeared forever. They have gone quiet. They are waiting for you to turn the power back on. I'm Dr. Claire Monroe, a men over 50 specialist and board-certified urologist. For years, I've helped men in their 60s, 70s, even 80s understand what erectile dysfunction really means, and what they can safely do at home to support their body again. Stay with me until the end of this video. I'm going to show you why this is happening, what it's really saying about your health, and simple daily steps you can start right now. Let's start with the most important truth. Erectile dysfunction after 50 is not your body saying, "You're finished as a man." It is your body saying, "I am under stress. Something in my system needs help." Think of an erection as a conversation between three systems. First, your blood vessels. They must open and relax so blood can flow into the penis. Second, your nerves. They must send clear signals from your brain to your pelvis. Third, your hormones, especially testosterone. They set the volume on desire, energy, and recovery. When you were younger, these three systems talked to each other easily. Signals were strong. Blood flow was quick. Recovery after sex or stress was fast. After 50 and 60, many things begin to change at the same time. Years of sitting, driving, or working at a desk can make the pelvis tight and stiff. That stiffness can press on blood vessels and nerves. Long-term stress keeps your body in fight or flight mode. This raises a hormone called cortisol. High cortisol, day after day, lowers testosterone and blocks deep recovery sleep. Poor sleep makes the problem even worse. Most of a man's testosterone is made at night, during the deepest stages of sleep. If you are waking often, snoring heavily, or never feeling rested, your hormone system cannot do its job. Blood sugar and blood pressure also play a role. If your blood sugar is high for many years, your blood vessels become damaged. They lose flexibility. They do not open as well. The smallest vessels in the penis are often the first to show trouble. So when erections fade, it is not just about sex. It is often the first warning sign that your heart, your circulation, or your metabolism needs attention. This is why I tell my patients, don't ignore erectile dysfunction. It is your body whispering to you before it ever shouts. There is also the emotional side. Many men feel shame when morning erections disappear. They stop looking at their own body. They avoid touch. They avoid intimacy. They say, "It's fine, I'm too old anyway," while quietly feeling smaller inside. That shame creates tension in the body, tension in the pelvis, tension in the breath. And tension is the enemy of blood flow. So you can see, erectile dysfunction after 60 is rarely about one single thing. It is a mix of circulation, nerves, hormones, sleep, stress, and silence. The good news is this. Because it is a system problem, small changes in the system can create real improvements. Gentle pressure work, better breathing, smarter routines at night and in the morning. In the next sections, I'll walk you through simple, safe practices you can do at home to support your body and help turn that signal back on. Now let's talk about what you can actually do. We start with something simple. No pills. No machines. Just your body, your breath, and a very important area most men never think about. Between your scrotum and your anus there is a small zone. In medicine, we call it the perineum. In many traditions, it is seen as the root of male energy. Under this point run muscles and nerves that support erections. Blood vessels also pass through this region. You do not need to know the names. You only need to know this. When this area is always tight or ignored, signals get weaker. When this area is relaxed and awake, signals get clearer. Here's a gentle practice many of my patients use at home. Find a quiet chair or the edge of your bed. Roll up a soft towel into a small cushion. Place it on the seat and sit down so that the towel rests under that space between your scrotum and anus. You are not pushing hard. You are not trying to force anything. You are simply giving that area a chance to feel safe pressure and support. Close your eyes. Place one hand on your belly. Breathe in slowly through your nose. Let your belly rise. Then breathe out gently through your mouth. Let your weight sink into the towel. No squeezing. No clenching. Just noticing. Stay here for 3 to 5 minutes if you can. Some men feel warmth. Some feel a light tingling. Some feel a gentle pulse. Some feel nothing at first, and that is okay. The goal is not to chase a big reaction. The goal is to wake up awareness in a par. One of my patients once told me, "Doctor, I thought that part of me was just dead. After a week of this, I felt a small pulse and I almost cried." Moments like that matter. They shift your mind from "I am done" to "maybe my body is still here for me." If you're a man over 50 or 60 and this is speaking to you, subscribe to this channel so you do not miss the next videos. Every week I share simple, safe ways to understand your body better, ways to support blood flow, nerves, hormones, and confidence without shame. For now, remember this. You are not trying to force an erection. You are learning how to listen to your body again. The root needs attention before the tree can stand tall. Now we move to the second pathway. Think of it as the highway that carries messages and blood to your pelvis. If you slide your fingers along the inner crease where your leg meets your lower belly, you're right on top of this line. Underneath are major blood vessels and nerve branches that travel toward your groin and penis. Years of sitting, driving, or crossing your legs can make this area stiff and tight. Tight tissue slows flow. Slow flow makes erections harder to achieve and harder to maintain. We are not trying to massage yourself back to age 20. We are simply helping that highway open again. Here is a gentle way to explore it. Sit or lie down in a comfortable position. Your leg can be slightly bent and relaxed. Place your fingertips on the inner crease at the top of your thigh. Then very slowly move your fingers down along the inner thigh, just a few inches. You are not digging deep. You are not trying to bruise anything. Think of it like exploring tight spots in a sore shoulder. Light, curious pressure. If you feel a tender area, pause there. Take a slow breath in. Breathe out and imagine that part of your thigh softening. Some men notice warmth as they do this. Others notice that their legs feel lighter after a few minutes. Some feel more aware of their whole pelvis in a way they have not felt in years. I had a patient in his late 60s who laughed when I first showed him this. He said, "My thighs? What do they have to do with anything?" 2 weeks later, he smiled and said, "This is strange, but I feel more alive from the waist down. And my mornings are different now." Again, this is not magic. It is blood flow and nerve awareness returning to an area that has been on pause. If this sounds like something you have been dealing with, but you almost never talk about it, I want you to do something brave. Type the number 1 in the comments. You don't have to share details. Just that simple 1 tells me and tells other men. I'm here. I'm dealing with this too. I do not want to pretend anymore. Many men over 60 feel alone with erectile dysfunction. You are not alone. You are part of a very large, very quiet group. And the moment you admit, even just with a number, that you are part of this, your healing can move from silence to action. The pressure points are important, but they work best when your daily habits support them. Think of it this way. The practices we just talked about are like flipping the light switch. Your habits are like making sure the power plant still has fuel. Let me give you a simple checklist you can start using today. You do not have to be perfect. You just have to be consistent. Habit 1. 5 minutes of belly breathing. Once a day, sit or lie down. Place one hand on your chest and one on your belly. Breathe in through your nose so that your belly rises first, not your chest. Then breathe out slowly through your mouth. Aim for 5 minutes. Set a timer if you need to. This kind of breathing helps your nervous system shift into rest and recover mode. That mode is where erections and hormones are rebuilt. Habit 2. 1 glass of water on waking. Before coffee, before tea, before checking your phone. Drink 1 glass of warm or room temperature water. Overnight, your body loses fluid. Thicker blood moves more slowly. Hydration makes it easier for blood to move through the smallest vessels, including those in the penis. Habit 3. Less sugar at night. Heavy sugar late at night hurts your blood vessels over time. It can also disturb your sleep. Try this for 2 weeks. After dinner, skip desserts and sweet drinks. Notice if your sleep becomes deeper. Notice if your morning energy shifts. Habit 4. 10 minutes of gentle movement. You do not need a gym. You do not need to run. A slow walk. Easy stretching. Moving your hips in circles while standing at the kitchen counter. 10 minutes a day tells your body, blood needs to move. We are still using this frame. These habits may sound small, but small habits done daily are what change systems. If this checklist is helpful so far, hit the like button so more men over 50 and 60 can find this video. Many men never hear these things from their own doctor. Your like helps this information reach them. Try these 4 habits for at least 3 weeks. Combine them with the gentle pressure work at your root area and inner thigh. Then pay attention to your sleep, to your mood, to the small signs of life in the morning. This is how you rebuild, one simple habit at a time. Now we need to talk about something deeper. Not blood, not nerves, not hormones. We need to talk about what you believe about yourself as a man over 60. Many men carry a quiet story in their heads. I'm past my prime. My wife doesn't expect anything from me anyway. I should be grateful just to be alive. Who am I to ask for more? On the surface, those thoughts sound humble, but underneath, they can crush your spirit. When erections fade, some men pull away from intimacy completely. They stop touching their partner. They avoid cuddling in bed. They fear that any touch will promise something their body cannot deliver. Over time, the bedroom becomes a place of distance, not warmth. A place of silence, not safety. I want you to hear me clearly. Your value as a man is not measured only by erections. Your worth is not defined by performance. But at the same time, your desire to feel alive, wanted, and physically present is real. You are allowed to want that. Many of my patients tell me, "Doc, I don't even know how to talk about this with my partner." Here is a simple starting point. You do not have to talk about erections first. You can talk about closeness. You can say, "I miss holding you without pressure. I miss feeling close even if nothing else happens." Can we start there? This shifts the focus from performance to connection. From "I must prove something" to "I want to be with you." As your body slowly responds to better habits and better awareness, you may notice changes. Small morning signs. Different feelings during the day. It is okay to be cautious. It is okay to be afraid. But it is also okay to be hopeful. Aging asks you to relate to your body in a new way. Not as a machine you push until it breaks, but as a partner you listen to and care for. When you treat your body with respect, when you give it breath, movement, touch, rest, it often gives something back. Not always in the way it did at 20 or 30, but in a way that fits who you are now. Steady, gentle, present. You still have the right to feel like a man, to feel alive in your own skin, to walk through the world with quiet dignity. The practices we talked about are not just about erections. They are about that dignity, about refusing to throw yourself away just because a number on your birthday has changed. Let's bring everything together. We started with a hard truth. Losing morning erections after 60 can feel like losing a piece of yourself. It can feel like a verdict. As a man, I am done. But we uncovered a different story. Erectile dysfunction is often a signal, not a sentence. A signal that blood flow is slowing, that nerves are less active, that hormones, sleep, and stress are out of balance. We talked about 3 key ideas. First, the root area between the scrotum and anus. Gentle pressure and relaxed breathing there can help wake up awareness in the muscles, nerves, and vessels that support erections. Second, the inner thigh pathway along the crease where your leg meets your lower belly. Soft exploration and light pressure along this line can help release stiffness and invite more warmth and circulation. Third, the daily habits checklist. 5 minutes of belly breathing. 1 glass of water on waking. Less sugar at night. 10 minutes of gentle movement. None of these sound dramatic, but together, they send one message to your body. We still need you. We are still here. Wake up and work with us. Here is how I want you to move forward. Next 7 days. Once a day, sit on a soft rolled towel under your root area and breathe for a few minutes. Drink 1 glass of water each morning before coffee. Pay attention to your sleep and energy without judgment. Next 30 days. Add the inner thigh pathway work 3 to 4 times per week. Practice belly breathing most days. Cut back on sugar at night as often as you can. Notice any changes, warmth, pulse, mood, or small signs of morning strength. These are not tricks. These are signals. Signals that tell your blood vessels, nerves, and hormones. We are building a safer, calmer, healthier environment for you. If you are a man over 50 or 60 and you don't want to walk through this alone, subscribe and stay with me here. This channel is built for you, for your questions, for your fears, for your quiet hopes. I will keep bringing you clear, respectful information about erections, hormones, prostate health, and real-world steps you can take. And now, an important note. This video is for educational purposes only. It is not medical advice. Every man's body is different. Always talk to your own doctor, urologist, or healthcare professional about your personal health, especially if you have heart disease, diabetes, high blood pressure, or are taking medication. Do not stop or change any prescribed treatment without speaking to your doctor. Gentlemen, your vitality is not gone. It may be quiet. It may be softer than before, but it is still there. Treat your body with patience and respect. Give it signals of safety and support, and watch how it starts to respond. Take care of yourself. Your story as a man is not over.